Two things to talk about today, and we appreciate you coming. One is about money, and the other is about a vaccine. All of those things have been in the news. As you're aware, the Accelerate SC Task Force has played a vital role in our state's economy, and we are confident that we are doing better than a lot of the other states are doing because we've made good decisions, collaborative decisions. The official recommendations and guidelines produced through Accelerate SC and the public effort have allowed our state to gradually and responsibly remove the limited and targeted measures enacted to combat the COVID-19 virus. One important charge given to Accelerate SC was the conduct of a thorough and complete review of the Federal Coronavirus Aid, Relief, and Economic Security Act, that's the CARES Act. They were also tasked with providing expenditure recommendations to my office for the $1.9 billion Coronavirus Relief Fund that included the CARES Act for the COVID-19 related expenses. On June the 10th, I provided the General Assembly with recommendations based on those from Accelerate SC for the first phase of expenditures of CARES Act funds. Those recommendations included replenishing our state's unemployment trust fund, providing resources to DHEC and the Medical University of South Carolina for statewide testing and contact tracing, also the creation of a statewide stockpile of PPE for the future, and funds to reimburse schools, colleges, and government agencies for COVID relief. Today, I have provided, you may have a copy of it there, for the second phase of expenditures of the Relief Funds, CRF, from the Federal Coronavirus Aid, Relief, and Economic Security Act, the CARES Act. That is, these are the recommendations for the second phase. First, the Unemployment Insurance Trust Fund. In order to prevent our state's small businesses from paying higher taxes to replenish the Unemployment Trust Fund, I have recommended that an additional $450 million be authorized and made available to the Department of Employment and Workforce for the Unemployment Insurance Trust Fund. As you know, in the first phase, I asked for, and the legislature provided $500 million into that fund. Second, for small businesses, I have proposed that $30 million be made available in the form of one-time $5,000 grants to small businesses, that is, to small businesses that did not receive federal funds under the Paycheck Protection Program loan from the administration. A lot of money went out under that program, but a lot of our small businesses did not receive that money. That would be enough money, that $30 million, to provide 6,000 small businesses in our state with a $5,000 grant, which we are confident would be very much welcome by all. Also, for certain nonprofits, I have proposed a similar grant for certain nonprofit organizations that were not eligible to receive the PPP loans because of their unique tax status. For example, a nonprofit like Riverbanks Zoo here in Columbia was not eligible. And while they were closed to the public, they still had to pay the employees, keep the place clean, take care of the animals. My proposal would provide $15 million to provide nonprofits the relief they would have received under the PPP loan. As for schools, for many South Carolina families, public schools provide the opportunity for parents to work, provide housing, meals, and economic security for their children. Literally, their lives revolve around those schools. When the children are in schools, that allows the parents to do many other things. And of course, we know how important it is for the children to be in school for a variety of reasons. Many working parents just simply cannot stay home with the children every day, but they have to go to work. They have to feed the families, provide shelter and security for their future, medical care and everything else. If a parent wants to send their children back to school, or if they want to keep their child at home, they should have their choice. They shouldn't have to choose between their child or their job. 19 school districts began this school year with their classrooms open 5 days a week. A large number of districts chose not to provide parents with that option. Parents are not happy. I am not happy. I don't know anybody who is happy about this. My office, among others, has been flooded with calls from parents and concerned citizens, as well as emails and letters, and there's a sense of frustration all across the state about this. If state law allowed me as governor to require school districts to provide in-person instruction 5 days a week as an option, I would have issued the executive order months ago. I have no authority to require the school districts to provide face-to-face education to the children. No authority. What I can do, however, is to help those schools which have opened for face-to-face education with the costs of doing that. The costs of in-person reopening are significant. And so I have recommended to the General Assembly that up to $50 million be authorized to reimburse public school districts and charter school authorizers for COVID-19 related costs incurred by those schools reopening and providing 5-day in-person classroom instruction to the students. South Carolina's economy is returning to normal because people have returned to their workplace following precautions designed to keep them healthy and working. I believe that schools are no different. I believe that by following official COVID-19 procedures and protocols, schools too can be reopened safely and sensibly, the same way business, manufacturers, restaurants, merchants, and state government have done and are still doing successfully today. And we announced some time ago and made it doubly clear to all the school districts, if they need the protective equipment, we will provide it at no cost. Many have asked, some have not. But we do not want the lack of the protective equipment, the personal equipment, to be a reason for not allowing those children, those parents, to send their children to schools. Finally, I have proposed an additional $93 million to be directed to DHEC and MUSC for continued and expanded COVID-19 testing as prevention, as well as municipalities, first responders, law enforcement agencies, public institutions of higher education, and technical colleges for COVID-19 expenses. As you know, the General Assembly will meet next week to discuss CARES Act funding, among other issues. It is my hope that just like they did in June, they will adopt these recommendations and the state can put these resources to work to provide the needed funding and relief right away. Second point is vaccine. I'd like to mention that the U.S. Department of Health and Human Services and the Centers for Disease Control and Prevention, known as the CDC, as you know, are rapidly making preparations to implement large-scale distribution of COVID-19 vaccines in the fall of 2020. The vaccine distribution program is expected to be an effort of significant scale, potentially involving hundreds of millions of vaccine doses to be distributed across the United States. In South Carolina, the Department of Health and Environmental Control will coordinate the distribution of this vaccine when it reaches South Carolina. Similar to the hospital bed surge plan that was formulated back in the spring, the vaccine plan will be a Team South Carolina effort and will involve the participation of numerous state and local agencies, healthcare providers, the National Guard, the Emergency Management Division, and everyone in between. I've asked DHEC to provide a brief overview of their planning and preparation for distributing this vaccine when it arrives, and we know that the initial shipments will begin and then others will follow. It will take time, but I've asked them to answer your questions about the vaccine and provide an update also on the nursing homes and assisted living facility visitation plans. And Director Marshall Taylor, if you please.
Thank you, Governor. Good afternoon. Before I begin, I'd like to take this opportunity to thank all of our public health professionals, countless partners, essential workers, and many others who continue to work around the clock to protect the health and safety of our residents across South Carolina. It's because of their tireless commitment and dedication that South Carolina can be hopeful that we will bring this virus under control. I'd also like to thank Governor McMaster and the legislature, as well as their staffs, for their leadership and their support of our important efforts to fight this disease. So first, real quick, I wanted to give an update on nursing home visitation plans. We have received to date 46 of these plans from facilities across the state, and we have approved 24 of these plans. We have 5 that we're waiting for additional information from nursing homes. We are working very closely with the Nursing Home Association and these facilities across the state to get their plans submitted to us and get them back out to the facilities so that visitation can start across South Carolina. It's very important that this happens soon, quickly, so that people can see their relatives and visitations can begin in the facilities that qualify for visitations to occur. With regard to vaccines, as there has been increasing national attention on the development of 3 different vaccines aimed at helping to end the spread of COVID-19. DHEC and develop a plan for distributing a vaccine within our state once one becomes available. The plan will be built on guidance and recommendations from CDC and the U.S. Department of Health and Human Services and other federal agencies. As a reminder, there is no confirmed date when a vaccine will be available. However, as we learn more, our team will provide the public information as that information becomes available. In lieu of a vaccine, we must continue in our united fight against this deadly disease by remaining vigilant about taking recommended precautions, including practicing social distancing, wearing a mask, and know your status by getting tested. I'll now turn the floor over to Stephen White, who is our Director of Immunizations, to provide more information about our planning efforts.
Thank you, Director Taylor. Good afternoon. So most of you, as Director Taylor has mentioned and the Governor has mentioned, have heard a lot about COVID vaccinations on the news and over social media over the last few weeks. Each day, with each person who enrolls in a Phase 3 COVID-19 vaccine trial, including right here in South Carolina, the medical world is learning more and more about here in the U.S. I know we are all hopeful that one of these vaccines will help put an end to this unrelenting virus that spreads without symptoms, literally stealing the breath from our loved ones and neighbors, colleagues and friends, not just in South Carolina, but also across the country and across the world. Although we don't know exactly when the vaccine will be made available in the United States, I want to assure you that DHEC is forging partnerships and following federal guidelines for developing a plan for distributing the vaccine within our state when it becomes available. This plan will be built on the guidance and recommendations from the CDC, the U.S. Department of Health and Human Services, and other federal agencies. the South Carolina Emergency Management Division, the South Carolina Hospital Association, the National Guard, South Carolina State Law Enforcement Division, Department of Labor, and other public and private sector partners are working closely with DHEC to develop South Carolina's COVID-19 vaccination plan. The overarching goal of this vaccination plan will be the equitable distribution of the vaccine across the state. We, just like you, have heard that an approved vaccine could be made available as early as this fall, and we will be ready. There are things that I would like for you all to know. One, key scientific stakeholders like the National Institutes of Health that no vaccine will be released until it has undergone the rigorous scientific and clinical testing that all vaccines in development are held to. Second, when the vaccines first become available in South Carolina, the numbers of doses will be limited. These limited doses will be allocated according to federal guidance to those at highest risk for contracting the virus and those at the highest risk of death. These groups include, 1, our frontline medical personnel, those individuals who provide care for our senior populations in nursing homes, 2, residents in nursing homes, and 3, critical infrastructure employees. As vaccination production ramps up and additional vaccines complete the approval process, we are being told that there will be sufficient doses available nationwide that we will be able to open up vaccinations to the general public. The vaccination is a 2-dose series, which means individuals will need 2 doses of COVID-19 vaccine in order to provide protection against COVID-19 disease. Timing between the first and the second dose is currently unknown. However, assumptions are we could be looking at 21 to 28 days or even longer. Individuals that receive the first dose will need to receive the same brand of vaccine for the second dose. Our current COVID vaccination planning process and timeline will continue to evolve as more information becomes available to us from the federal government. And as we learn more, we will continue to keep South Carolinians updated on the status and availability of COVID-19 vaccines and our plan to make it available to the far reaches of the state as soon as the supply allows. Remember, the first doses of the vaccine will be available for those at highest risk for developing severe complications and death from COVID-19, as well as the medical professionals and essential workers who are routinely exposed to the virus before the vaccine will be available in mass quantities. Months that will be especially difficult as families plan for holiday gatherings while continuing to protect those most vulnerable. During these challenging times, as we wait for the vaccine, there are things we can do to make sure that we get to the finish line together. 1, we encourage everyone to please continue to wear your masks when you're around others, even while outdoors. Please maintain at least 6 feet of distance from others. Please avoid group settings, especially in indoor spaces, and make sure you wear a mask and socially distance if you must be in a group setting, even if outdoors. If you don't feel well or have symptoms of illness, including mild symptoms like a sore throat, a cough, or headache, stay home. And lastly, please get your flu shot. Finally, I'd like to remind everyone that currently more testing opportunities are available in South Carolina more than ever before. We have more than 540 permanent and mobile testing locations, and the turnaround time for the results is becoming faster and faster as time goes on. We encourage anyone who thinks they should get tested to get tested, and anyone who is regularly out and about in their community and in close proximity to others because of work or other reasons to get tested routinely at least once a month or more. Please take advantage of the testing opportunities that DHEC and our essential partners have made available, because it's never been easier or accessible, and testing remains a critical part of this fight against the vaccines. Thank you.
going to go far.
I'm not.
Are there any questions? Yes, ma'am.
Today we found out via the Twitter account of the Ohio governor that Dr. Duvia is going to be leaving DHEC. When were you all aware, and is there a reason that she is leaving DHEC?
Yeah, so we learned of that this afternoon as well. My understanding is that she has family in Ohio, and she's going to be closer to her family. And actually, this is a promotion for Dr. Duvie, and so we're very happy for her. We will miss her. She has been an asset to DHEC.
Via Twitter?
No,
Okay.
I learned from Dr. Duvie.
So when is her last day?
She's going to be here for a few more weeks, so there's going to be a transition period. It'll be a smooth transition.
Who will be her after she leaves?
So that'll be determined. That's still to be determined.
On the issue of the vaccine, once it does become available, well, number one, we know that MUSC has been testing one of those vaccines. Have they given any kind of indication on when that vaccine may be available?
Not that I know of, but Stephen?
I'm not aware at this moment in time.
Also on the issue of vaccines, you kind of have two pots of people. You have some on one side who feel like we've been rushing the vaccine and that it may not be completely ready by the time it is ready. Then you have another, sect of people who are against vaccines in general. Are you concerned about both of those numbers kind of being combined and heightening?
Address that as best as I can and with what ability I do have. Messaging is very critical for who can get the vaccine and when it's available. And to your point about safety of vaccines, what we have heard thus far from our CDC counterparts and others on a national scale is that the vaccine will be safe and efficient before they push it out. And that's all that as far as DHEC is concerned, we don't make those decisions.
Today at USC, Dr. Birch said that there would be a surge testing team coming to South Carolina. Can someone explain what's going on there?
Yeah, so a surge testing has been done across the country by our federal partners, and they've chosen Columbia to come and do surge testing, which is basically they are here for 12 to 14 days. And they provide all the testing supplies up to 5,000 tests per day. And so it's a great resource, additional testing resource for the Columbia area. And those sites are still being determined. That testing should start, I believe, next week, but they'll be here for several days. DHEC and the University of South Carolina is going to help provide the resources, the logistical resources for those teams. But they do bring in all the testing supplies. They do all the analytical lab work on those tests, and great resources in South Carolina.
And so will only be in Columbia or around the state?
The Columbia area. It's just going to be in the Columbia area, and at this point, I believe they're planning for 2 sites in the Columbia area to be announced.
Governor McMaster, a third-grade teacher in Richland County School District 2 has died from coronavirus. Have you been in contact with State Superintendent Molly Spearman in terms of an action plan in case there are more deaths?
Well, the school districts each one has their own action plans, and we're of course, very sorry about that. There was a question over there.
Yeah, Governor, given this death of this 28-year-old teacher, are you worried? You asked schools to open back 5 days a week. Are you worried?
The virus is still here. People are going to get it. The evidence is very clear, and some of them are going to be teachers, some are going to be students, some are going to be maybe even some of us here. But we have to be careful, but we have to move forward. We cannot live in fear of the virus and shut down every institution in sight. It will not work, and it certainly won't work here. Yes, ma'am.
I have 2 questions for Director Taylor. First, where's Dr. Bell?
Where's Dr. Bell? She's working at DHEC. She's the head of our date area, and she is in the middle of this response and cannot be more happy to have her there.
And my second question, I've spoken to a couple coroners in the past few days, and they've been saying they've had some inconsistencies with some death reportings
of your numbers and their numbers, and I don't know if maybe there's an explanation on where there might be some confusion and inconsistencies between those.
Well, the coroners get their information through a different stream than we do sometimes, which can result in inconsistencies. And every death, the coroner is, my understanding is, the coroner is not notified of every death in the county. It's the deaths that they are involved in the investigation. And so between that and the lag in information, sometimes related to the information that they receive and we receive, can result in some inconsistencies. But we've been working or trying to work very closely on the information that they need and that we can legally provide. That's another issue, is that we're restricted under the law as to who we can provide certain types of information.
Is there a disconnect between the agency, and some coroners? I know one today in Kershaw was saying he's had a lot of trouble trying to get a hold of people at DHEC to discuss about these inconsistencies.
Well, there shouldn't be a disconnect, and if there is, then I need the coroners to call me, and we'll make sure that we communicate quickly and efficiently, because the coroners are a very important part of this process across the state.
Director, while you're up there, so Dr. Duvay's departure, how will that affect the agency's response, especially if you don't know who could be filling the role?
Well, it will not affect the agency's response. We have many qualified physicians still working at the agency, and we have leadership in the public health area that are there now, and Dr. Duvey is going to be there until we determine who will take her spot. So it will be a seamless transition, and we will continue to respond to this event as we have while Dr. Duvey was here and before Dr. Duvey was there. So thank you.
I'm Director Taylor. This week, DHEC announced that thousands of negative COVID-19 tests weren't in the database. Can you explain a little bit what happened there over the last few months, why thousands of these tests weren't in that database?
Well, many of the tests we didn't receive. I believe there was a report due to misunderstanding by many of the labs across the state as to that negative results to us. And despite the fact that we put out notifications back in the early parts of the spring saying that was necessary. So we have made it very clear to everyone that both negatives and positives are to be reported to DHEC, and those are being entered into the system when we get them, and so that should clear up any problems going forward.
Do you think that skewed the percent positive over the last few months that we've been seeing across the state?
I don't believe it. My understanding is there's not a significant impact on that, but that will be determined once we receive all these results and we can look at the numbers going forward.
Back in the back, yes, ma'am.
You're giving all this money to the schools that did follow your guidance to move back to 5 days a week face-to-face. Is this somewhat of a punishment for those schools who
No, ma'am, it costs money to open school. You have electric bills, you have to clean, expenses involved, and this is directed specifically at that. And we hope it will allow some more easily to open up.
This is a healthy 28-year-old teacher. How many teacher deaths is acceptable a week to continue with
0.
5 days a week?
No death, a teacher otherwise. It's always a tragedy. I didn't know the young lady. What I read sounded like a beautiful person. It's sad. We're sorry for the family, but we've had a lot of people die in the state because of this virus, and that's the reason we're here. As low as possible, and 0 is the acceptable number.
Director,
Yes, ma'am.
I have a question about the vaccine. Is there a particular percentage of South Carolinians that you would want to see covered by the vaccine that would help that would solve
Yeah, I'll
the state's
answer that,
COVID
all
problems?
of them.
Okay.
But that's not going to be possible at the beginning. Would you like to, Mr. White?
Yeah, so that's a great question, and to Governor McMaster's point, we would love for everybody to get vaccines. However, we do understand that not all communities and not all populations do receive vaccines. So we will do our best to manage expectations for when the vaccine is available. Just another point is that vaccine is only indicated at this moment in time for adults, not for children. So that's very important as hopefully more vaccine will become available for children in time.
On your list, when you say critical infrastructure employees, can you detail like who's a priority among those what's critical infrastructure?
So there's a very long list that the CDC and CISA and the groups will, that we have a list. And so I think we can provide that information maybe on our website to you. It's a very long list.
Following up on that, the CDC asked states in a letter to have a distribution plan for vaccines in place by November 1st. Is the HEC following that timeline in terms of expediting licenses and permitting as the CDC asked?
Right. So we are working closely with the CDC. We're working with them on a weekly basis and sometimes even on a daily basis as new information is coming out. A vaccine plan is actually going to be due to the CDC prior to vaccine allocations coming to the state, which we hope to have by the end of the month. So yes, to answer your question, we will be working with CDC on our vaccination plan, and they will be intricately involved.
I have a question for the governor.
My question's for the governor as well. Obviously, there's mixed reactions with vaccines when this is available, and if you can take it, would you?
I don't know if I'll be one that's on the list to take it.
When it's
'cause this could
available
be-
for more folks.
Oh, and it's available, yes, and a flu shot.
Would the governor not be considered a priority to get a vaccine?
Our governor's not a priority for some people.
I have a question about colleges, Governor. Obviously, colleges across the state have been opening up. We've seen very high cases, including at the University of South Carolina. Bars in particular, bar owners in particular, have been raising some alarms. They feel like they're in a tough spot, right? Because they're reopening, trying to get business in, but then at the same time, colleges have been reopening and you have just a crush of students coming in. I'm wondering, what is your message to particularly, your University of South Carolina, Clemson, your larger schools, where these students are where the schools are seeing high numbers of positive cases? What should they be doing to help limit that crush of students?
They're doing it. President Castlin at the University of South Carolina and all in Columbia, as well as the regional campuses, and Jim Clements, President Clements at Clemson, and others are working hard on their plans. What I've encouraged them to do is to do all they can to keep the students on campus, that is not going home, to keep them here where they can be in touch with them and can coordinate with them and see that they're tested. And let me mention on the test, and we have confidence in the leadership of all of those leaders. But I would encourage everybody to get tested if you haven't done it. I've done it, I think, 4 times, 2 at the hands of Dr. Traxler. And there's really nothing to it. And so I would encourage people, it's so widely available in our state and going to be more so when that team gets here, that it's a good time to get tested. And it doesn't hurt.
There's been a real drop-off in people getting tested. If or you or the director could address that, why have we seen such a drop-off?
Well, we're not exactly sure, but we think some of it is testing fatigue. People have been tested, and the process can be uncomfortable to some, but that is actually getting better because there are new types of testing, saliva testing, also testing where you don't go all the way up in the nasal cavity but lower in the nasal cavity. So, the times of those painful tests, or not painful but uncomfortable tests, are hopefully soon behind us. The other thing is, I think there are a lot of asymptomatic people out there walking around with the disease that don't have symptoms, who don't think they need to get tested. And those are the people really that we really want to get tested, so we know that they have the disease and that they can take the appropriate steps and to protect themselves and their family and their friends. We are making testing widely available. It's just like the governor said, it's easy. It's no longer uncomfortable, and so we just would request that people get out and get tested.
Director, we've heard of some issues with people reporting death certificates of loved ones saying they had COVID when they were never tested or didn't show symptoms. What are you guys doing with people who maybe don't trust those death numbers because their loved one actually was never tested for COVID, but it shows up on that certificate?
Well, I'll tell you what, I'm going to let Dr. Traxler speak to the death certificate issues.